Good afternoon. We'd like to welcome you to our daily COVID-19 update for the town of Plymouth. This is update number 34. It's coming to you live on Wednesday, April 29th, 2020. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each day, Monday through Friday at noon for this update. This forum is being brought to you live by PAC TV, and we thank them. It's on Comcast channels 13 and 15 and Verizon channel 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums are also replayed at pactv.org/Plymouth. Now, today's participants joining Kenneth Tavares and Matt Muratore are Dr. Barry Potvin. He is the Vice Chair of the Town of Plymouth Board of Health. Also, Michael Jackman, who is on staff with Congressman Bill Keating's office. Heather Cozby, she's a CPA in the Town of Plymouth. Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. And Michael Hargrave, who is going to talk to us about Mask for Meds. And we're going to begin, as we do each day, by welcoming the Chair of the Plymouth Board of Selectmen, Kenneth Tavares. Welcome, Ken.
Last night, the Board of Selectmen met at 5 o'clock. We had a meeting that went about 2 hours thanks to PAC TV. Some of the highlights of the meeting were we awarded an alcoholic restaurant license to a new business coming into 47 Court Street, which is good news. There was a lengthy discussion with the finance director and the town manager as it regarded future financial plans for the town. The board looked at various scenarios that were given to them by the finance director and the town manager, and has requested additional scenarios to be run and reported back to the board at next week's meeting on the 5th of May. The moderator, I'm sure he'll speak to it, did a good job in talking about the status of the virtual town meeting and the survey that was taken amongst the town meeting members. We also spoke at length with the town clerk in regards to the state election and some of the challenges that Mr. Pizer is facing. He has a number of inquiries to make today, and we anticipate carrying this discussion forward next week also. The board supported the Board of Health in applying a $300 penalty if anyone is caught improperly disposing of gloves, facial coverings, and any other materials that might be tainted by the virus. We will go into that in a little more detail at this meeting. Back to you, Steve.
Thank you, Kenneth Tavares, Chair of the Plymouth Board of Selectmen. And each day these come to you live. We date stamp at the top right-hand corner, and we try to bring local, state, and federal officials, also experts in fields that are responding to the coronavirus. We have a business component, usually a health component. And as Kenneth Tavares did state in his opening statement, I did zoom in yesterday to the Selectmen's meeting as your town moderator, and I announced that following yesterday's order of the governor extending the stay-at-home advisory until May 18th, I determined that it would be appropriate to further recess and continue Plymouth's annual and special town meetings to Monday, June 15th at 6 p.m. And we have the declaration of recess and continuance. The reason why that day was selected, it would give at least another month after the current advisory is scheduled to end, and it is the Monday prior to the town election, which is scheduled for Saturday, June 20th, and therefore it would give town meeting members an opportunity to participate if we go forward. This will still be subject to further review, and as Kenneth Tavares stated, there was a survey conducted by the Committee of Precinct Chairs. We want to thank the Committee of Precinct Chairs and Alan Costello, Chair of the Committee of Precinct Chairs, for compiling feedback from town meeting members. And that survey asked town meeting members to tell us whether or not they are comfortable meeting at Plymouth North High School in person or outdoors in person, or do a virtual town meeting, or no town meeting at all. And the results were by more than a quorum of town meeting members. Our quorum is 90 town meeting members. There were 95 who participated, and an overwhelming majority expressed a preference not to meet in person, either at Plymouth North or outdoors. Rather, there were 26 that supported a virtual town meeting, either full or abbreviated with a pared down agenda. And there were 28 that requested no meeting at all until all clear, as you would define that. So at this time, we've recessed it till June. We're going to further review to determine whether or not it's appropriate to go forward. And finally, Representative Mathew Muratore has co-sponsored legislation to enact the enabling statute for a virtual town meeting, but unless that's passed, we would not be able to do that unless it was some hybrid of a virtual in-person at Plymouth North High School. At this time, we're going to go and show the town meeting survey. PAC TV is able to show it to you, and you'll see that we have 11 who favored meeting at the high school, a full meeting, 16 an abbreviated meeting, 8 for a full meeting outdoors, 3 for the abbreviated meeting outdoors, 17 for the full virtual, and 9 for the abbreviated, and 28 no meeting at all. And there were 2 that expressed no preference. The 95 participants would be 70% of all town meeting members. At this time, we're going to move with our panel, and we welcome back the Vice Chair of the Town of Plymouth Board of Health, Dr. Barry Potvin. Welcome, Barry.
Yes, thank you, Steve. Good afternoon to everybody. There's a couple of major things I need to discuss with you today. One won't take very long. There is a notice on the Department of Public Health website concerning potential hazards from common household disinfectants. This came out of some reports that at least one person mixed together bleach, vinegar, and water in order to wash produce, end up producing chlorine gas. Chlorine gas is extremely hazardous, can attack mucous membranes and cause burning in the eyes, and in large doses can be fatal. So you have to watch out for things like that. Please also be aware that you cannot mix bleach and ammonia. It also produces something very toxic and dangerous. In general, you should know that disinfectants are very toxic substances. They're only to be used on inanimate surfaces. If you ingest them, inject them, or inhale them, it may result in very serious injury or death. Sanitizers, on the other hand, are meant to be used on skin surfaces in order to reduce the number of potentially harmful microorganisms, such as bacteria and some viruses. Proper hand washing, however, is still far more effective than using hand sanitizers. There was one report that came out recently also of a young child actually ingesting hand sanitizer and having to go to the hospital. So if you have children at home, please be sure to put those containers someplace where they're not likely to be easily reached by the children. One other hazard was reported not from this country, but from one of the Middle Eastern countries. Apparently more than 700 people have actually died because they ingested methanol, thinking that it was a cure for the COVID-19 virus. This stuff, again, is very, very hazardous, can cause permanent blindness, coma, and possible death. So be very, very careful with these materials. Use them for only what they're intended for. If you're wondering about any of this, always go to a trusted source like the CDC or the DPH or the FDA. The other major topic, which may take a little bit longer, but I'll try to do it as quickly as I can, pertains to the new order from the Board of Health about you wearing of the face masks. So this came out, it's effective today. The select board discussed one part of it last evening, but it's divided into sections. So all members of the public entering any essential business, such as pharmacies, grocery stores, farm stand stores, home improvement stores, banks, ice cream stands, government agencies, liquor, beer, wine stores, convenience stores, anything like that, now must wear facial coverings, such as fabric masks. You don't have to use one that's commercially available. You can use your own sort of face covering. Do not use N95 masks. Those are really meant only for medical professionals. So that was the first paragraph in the order. The second was about all members of the public entering restaurants or drive-throughs for purposes of picking up food or takeouts of medications must also wear facial coverings over their mouth and nose. Just to clarify that a little bit more, there are establishments that do contact-free delivery, which means that in some cases they'll actually put your order, which you phone into them or do online, in an area outside of the entrance or directly inside the main entrance where you won't come into physical contact with another person working at the store. One of them that I know of actually puts it on an outside table and then calls your name. You then get out of your car and go pick it up and bring it back to your car. So that would not require face coverings. The next paragraph pertains to employees of essential businesses and the requirement that they should also wear facial coverings. From what I've seen, that's already underway. And every place I've been recently, everyone, whether they're employees or customers, were all wearing facial coverings. So I think that's already under full compliance. Food and goods and delivery personnel. So when you get things delivered to your home, usually nowadays, most people are just dropping them at your front door, maybe or maybe not even ringing your doorbell and knocking on the door and leaving before you even come out to retrieve the package. So if that's the case, you don't need facial coverings, but if you interact with the delivery person, then you both should be wearing facial coverings to protect each other. Another paragraph pertains to members of the public, including anyone who's a work person, entering and exiting a residential or commercial building complex with more than 2 units with a common lobby. You must also, in those cases, wear facial coverings over your nose and mouth while you're in the common areas or communal spaces and exercise social distancing if you can possibly do it. The one that the select board worked on last evening requires everyone to properly dispose of all their gloves and facial coverings and any other personal protection equipment because these may be potentially contaminated with viruses which could be infectious to someone else picking them up. So you need to put them into appropriate disposal bins if they're not available. You need to put them into trash cans. If those are not available, you take a mask that you've worn. Here's one of them. Notice also that there's elastic bands on the sides of these things. When you take them off, you should only touch them with the plastic bands. And then if you can't find any other way to get rid of them, all you need to do is try to put them inside of a disposable plastic bag to bring them home and then properly launder them because the detergent and the washing process and drying process will inactivate any viruses which are present. There was another component of this which pertained to fines. And again, I would caution people to please read carefully the statements on the order which was put out, because you'll notice if you do that, that it's worded such that there may be fines imposed, and the fines may be up to $300. That was approved by the select board last evening. Doesn't mean that everybody who's caught improperly disposing of something is going to be fined. I imagine if that's observed, there would be a warning involved. And if a fine is a last resort, it isn't necessarily going to be for $300. So that's all, I think, pretty important information that everybody should have. And if there's any other questions pertaining to the order, I'll be happy to try to answer them during the question and answer period. Thank you, Steve.
Thank you. Dr. Barry Potvin is the Vice Chair of the Town of Plymouth Board of Health. We now go each Wednesday to Michael Jackman, who is on staff with Congressman Bill Keating. Welcome, Mike.
Thank you, Steve, and thank you again to PAC TV for giving us the opportunity to talk about what's going on at the federal level that's affecting everyone. The few weeks that I've been on, I've talked about a lot of the direct economic programs like the stimulus payments, the economic impact payments, unemployment, and the payroll protection program. But I also wanted to just mention in the CARES Act that was passed back in March, there was significant amounts of funding, and we're hearing from some of our healthcare organizations who are now receiving funding from what they call the Provider Relief Fund. And this fund was for healthcare providers who, largely who deal with Medicare population. So a lot of it's nursing homes, hospitals, obviously, community health centers, other providers. And the funding was so that they could prepare for, and respond to the coronavirus pandemic. And as we're seeing in the papers every day and hearing about what's going on at the nursing homes and long-term care facilities, just think it's so important that they have funds so they can purchase equipment that they need and get more testing, which I'm going to mention a little bit more about in a minute. Just to kind of give a report on that, there have been two what they call tranches or allocations, over $39 billion out of the $50 billion that was appropriated in the bill. And from the two tranches, over 9,000 providers in Massachusetts have received funding, representing over $1 billion. So just to show that the funding is coming out, and a lot of the providers are getting it, and they're facing some real challenges. To state the obvious, we need those hospitals, we need those healthcare providers to respond and care for our loved ones and those of us who are suffering from COVID-19, but also we need them to be here after the pandemic passes, and we need them that healthcare structure to be solid and sound and well funded and able to survive this and be available for us in the future. So just thought that was important. I did want to also mention, I know folks have talked about it on other shows this week, but the Congress did pass and the president signed another round 4, they're calling it. It's the Paycheck Protection Program and the Healthcare Enhancement Act. Excuse me, is passed last Friday, April 24th. And sort of the high level item was that it increased the funding for the payroll protection program by $310 billion. One of the things that Congress did add are some set-asides for community banks, credit unions, minority-owned lending institutions to try to make sure that some of this funding does get to small businesses that were left out in the first round of funding. Out of that 310 billion, it's about 20%. 60 billion was set aside for lending and institutions of $50 billion in assets and below. So the intent was to make sure that smaller banks, smaller businesses who work with those smaller community banks and credit unions can access some of this funding. So that was really important. The other thing that I want to mention from the bill that was passed last week, there is another $75 billion for hospitals and healthcare providers. We'll be working with HHS and the administration to see how that funding is rolled out. And, everyone talks about testing. The governor talks about testing every day and how important it is to have testing so we know when it's appropriate and safe to reopen the economy and reopen our society. But we can't do that if we don't know who is infected, or we don't know who has the virus or has already had the virus. And employers need to know that information too. So this bill did include $25 billion for testing. About 11 billion of that is going to go to the states. So Massachusetts will have some direct funding to implement some of the things they're doing, including the contact tracing, which is pretty innovative and has really become a model for the whole country in terms of how to surveil the virus and who has it and who they've been in contact with and a way to contain it. There's funding for the CDC for contact tracing, and there's also funding for NIH to develop rapid testing and do some more research on rapid testing. So I just wanted to point out that there is funding through this latest bill that was passed that is going to not only to small businesses, but also to healthcare facilities, because it's so important that we have the testing in place and that they have the PPE and the equipment that they need to deal with this crisis and to have that foundation of a healthcare system if as we move out of the crisis. So just want to report on that, and I'm happy to take any questions. Thank you, Steve.
He is on staff at Congressman Bill Keating's office. He joins us each Wednesday along with Heather Cozby. She is a Plymouth CPA. Welcome, Heather.
Hello, Steve. Hello, everybody. Thank you for having me again. The gist of this week's update is I have seen money flowing from all the programs in this past week. So that would be stimulus payments, unemployment, the federal benefit, the $10,000 grant from the economic injury disaster loans, as well as the PPP funds. So the good thing is, as of last week, not everything was flowing. This week, people are seeing money hit their accounts. They're not even being told necessarily. They've just discovered that it's shown up. So I did want to kind of just go through a few items. For individuals, on a personal side, you guys are pretty much all set up and in place. The IRS updated the tool on their website that is the Get My Payment, so you can check the status, update your banking information, things like that. That tool is not working correctly as of last week, and I actually went on this morning myself and was able to see it working. I have one tidbit of information that I'm getting a lot of questions on. If you are a taxpayer that had a refund on your 2018 or 2019 tax return, and you had that refund applied to your estimated taxes, so you didn't actually get the check, when you fill out the information on this tool at the IRS website, you need to enter in the amount 0. Do not enter the amount of your refund that was applied. It won't work. But if you enter 0 in the amount of the refund, it will work. And then you'll be able to add your banking information. So I don't remember when the cutoff date is. There's a little bit longer for you to actually update your information to get a direct deposit amount. Otherwise, they will mail you a check and they'll tell you, if they don't have your banking information, what week you should be expecting that check to be mailed. The other major part that's all in place for individuals is the unemployment benefits at the Massachusetts unemployment website. The federal benefits are being administered. If you were displaced, early on in this process, the date of your unemployment, you'll be getting a federal catch-up payment as a lump sum payment of the $600 a week for however many weeks have been outstanding. And then you'll continue to receive that benefit. That benefit is also flowing for self-employed. I've had confirmation from clients that they went on a Monday, they filled everything out, and by that Friday, they were receiving both benefits, any state benefit they might qualify for, as well as the federal benefit. So those programs are well in place, and hopefully for individuals, there's not going to be a lot more updating going on for you. On the other side of the world, for the business side, there's going to be a lot more updating and a lot of follow-up on the programs that are in place. And the first one I want to talk about is the economic injury disaster loan. That is we're referring to as an up to $10,000 grant. The grant is based on how many employees you have, and it's $1,000 per employee. This was actually the first program on the SBA's website that you could log in immediately and apply for. So without any notice or any information coming, because when you did that application, you provided your company bank information, deposits have been hitting everybody's accounts. In the amount if your application said you had 5 employees, you just received a $5,000 deposit. It is my understanding this is a true grant because there is no loan document, there is no additional paperwork required. So that everybody should be looking in their accounts. If you applied for it, you should have seen that by now. The last piece is the new SBA round of the payroll protection program. I wanted to just provide a little bit of information on that to hopefully help through this second round. SBA opened up or resumed receiving applications only 2 days ago. I've actually have interactions with banks, and I'm not going to name them, that even though the second round is up, they have chosen to not accept any additional documents. So if you're with a bank that has chosen to do that, you need to quickly try and find another source for the funding. It could be another bank. There's some places that are online. QuickBooks, for some reason, Intuit, is doing that. You can look around, you'll be able to find something. But that funding was gone within 2 weeks before. So I would expect this to go faster because there have been multiple applications being prepared during the time frame that the program was down. So I expect this round of money to go very fast as well. The other thing that businesses, now that a lot of people have been receiving their money, they've gotten their PPP funds, and everybody's a little nervous to make sure they use it correctly. They want to make sure that they're going to have their debt forgiveness done correctly. And I wanted to just reference businesses to always be checking the SBA.gov website, because they have a FAQ, a frequently asked question document that they update every few days. So as more information comes in, they're making statements about basically how they're going to address certain issues. So that document was actually just updated again yesterday. And I recommend everybody who has one of these loans continually follow that document as well. So the main issue with these funds is that if you receive the funds, you have 8 weeks to incur qualifying expenses in order for those expenses to be forgiven. So you need to be very careful and understand how you use this money to make sure you understand how much of it will be forgiven. To the extent you do not have the funds forgiven, it's not horrible because the loan terms are so favorable. It's 1% and it's over 24 months, except the first 6 months, there's no interest or payments due. So it's a favorable loan, but be careful how you use it. Understand you could end up with a loan and not having it all forgiven. You also have the option of using unspent funds and repaying it and being done with the program. So, and with that, the next thing that businesses need to be looking for is going to be the guidance from U.S. Treasury and SBA on how you do your loan forgiveness application. I have not seen this process or application yet on SBA's website, because that's your next step. You get your funds, you get your business going, you rehire your employees, then you need to be doing this application to have the funds forgiven, and you're going to be following whatever those regulations are. So that's the next big thing to look for. That's everything that I had so far for this week. Thanks, Steve.
Thank you. That's Heather Cozby. She is a Plymouth CPA. You can send her and the other members of our panel questions by emailing at plymouthinfo@pactv.org. And each Wednesday, we also go to Amy Naples. She's the Executive Director, Plymouth Area Chamber of Commerce. Welcome, Amy.
Hey, Steve, thanks for having me as always, and good afternoon, everybody. I am so excited to share the announcement of the Plymouth One Fund, which is a collaboration with the Chamber and Mass for Meds. The Plymouth One Fund was created to support the vibrancy of Plymouth's small business community and will provide financial assistance in the form of unrestricted grants to support operating costs. The Chamber will collect the donations and administer the funds with the guidance of the committee, and 100% of those funds will be distributed to our small businesses in Plymouth. Businesses will be asked to complete an application form to determine eligibility, and it is our hope to release multiple funding rounds as they become available. So the more money we raise, the more businesses we can help. And the Plymouth Area Chamber of Commerce knows that when small businesses succeed, we all succeed. And that's how our partnership formed with Mass for Meds. This group of like-minded community members had first created a grassroots fundraising campaign with a 2-phase initiative in mind. First, to provide PPE masks to our frontline workers. The second phase was to create a community relief fund for Plymouth small businesses. And we certainly know how much support they need right now. And that's why we joined forces. We created the One Fund in the wake of this pandemic and realized the critical need for something like this. So our goal is to grow the fund over time with fundraising events and business partnerships so that it can be a ready resource for our small businesses during these especially difficult times and beyond. And because rising tides lift all boats, we are looking to partner with interested businesses and organizations, because launching, growing, and maintaining the Plymouth One Fund requires both grassroots support and the generosity of those who can give a little bit more. So if an organization or business would like to get involved, we would love the opportunity to talk with you. If you would like to donate, you can do so by visiting plymouthchamber.com, and it will pop up right away. You can't miss it. The fund will grow by all of us working together. We are one Plymouth, we are one community, and we will all come together to help. And lastly, today I have the pleasure to bring a guest along with me, Mike Hargrave, who is part of Mass for Med's team. He's going to share the details about our first kickoff event that we are so excited about. So that is our exciting business update for today.
Executive Director, Plymouth Area Chamber of Commerce, and as she said, today we welcome Michael Hargrave. He is with Mass for Meds. Welcome, Mike.
Thank you, Steve, and thank you, PAC TV and Amy, for inviting me today. Like Amy said, we want to kick this Plymouth One Fund off with a great event. And we put together Couchella, which everyone's stuck at home on their couch. I see the flyer up there now. It's Saturday, May 9th from 7 to 10 p.m. and it's going to be broadcast on PAC TV, as well as PAC TV's Facebook Live and YouTube Live for everyone to tune in. The featured entertainers, we have Jake Hill, we have Hitch from Third Left, Zach Fay, Haley Sabella, Mike McKenna from Mountain Weekend, Abby Vale, Chris Ballerini, the Lindsays, and Pat and Tom Fay. You can't have an entertainment event in this town without hitting at least multiple Fays. One of the most talented family and just unbelievable people. So we are so super excited about this event. We think people will really enjoy it. And also kind of breaking news, what happened this morning is that the Mayflower Brewing Company has stepped up to sponsor our event. And they're going to be packaging beer with the Couchella label on it. And they've agreed to donate the net proceeds back to the One Fund. So this has just been such an unbelievable experience for every one of us that have been involved with this, just to see the willingness for people to help. And when my wife and I were watching Jake Hill live on Facebook and thought that this idea would be good as a fundraising event, we reached out to him, and all of the artists we reached out to just immediately responded, how can we help? They didn't ask, any details or anything. They just immediately jumped in to support this. And we want to support them because they're not able to perform in the bars and restaurants. Their fans haven't been able to see them other than in a little box like this on Zoom or Facebook Live. So we just wanted to give them another outlet to perform in front of their fans. And at the same time, hopefully generate some donations to go back to this amazing fund. So thank you so much for letting me come on and explain this all to you.
Thank you, Michael Hargrave, Mass for Meds. And at this time each day, we have an update from the state through our Plymouth State Representative, Mathew Muratore. Welcome, Matt.
Hey, good afternoon, Steve. Good afternoon to everybody. Let's start with a little bit of good news. We've had 13 days now in a row that the hospitalizations have been flattened. And as we've talked about over the last several weeks here, is that we really need to see the curve starting to be flat and then starting to see a decrease. So it looks like that we are there with the hospitalizations. They've been running between 7 and 9%. And those are people that are hospitalized with a COVID-19, and we are at 7% as of yesterday. With regard to the numbers, there's been an increase in testing from the day before by 9,613. So over 250,000 people in the Commonwealth have been tested, and the total number is 254,500. With a total positive tests of 58,302, which is an increase of 1,840 from the day before. So we are at 23%, and that is averaging out the same over the last several days as well. 23% of those that have been tested are positive for the COVID-19, with again the average age of 54 years old. And then unfortunately there were another 150 deaths from the day before. So we're over 3,000. We're at 3,153, which is 5.4% of those folks who have been confirmed positive have unfortunately passed away, with a 57% of those folks been living in long-term care facilities with an average age of 82 years old, and 98% of those that have passed away have had an underlying health condition. And as of yesterday, the percentage of males to females is exactly even. It's 1,574 males, 1,572 females have passed away from this. As I stated, the hospitalization is flattening now. So we're actually seeing that curve starting to flatten out. The percentage of hospital beds that are available at this point still is around 54% in the Commonwealth. In Southeast Mass, it's about 50%, which with 14% of those as ICU beds. With regard to BID Plymouth Hospital here, there are, as yesterday, there are 53 cases of confirmed COVID-19 cases, with 9 of those patients being in the ICU. And South Shore Hospital is reporting 128 cases with 12 in the ICU. With regards to long-term care, there are 11,022 cases of COVID-19. That's residents as well as folks that work at these facilities. And again, long-term care facilities are nursing facilities, assisted livings, and rest homes. And there's at least one case in 310 of these facilities. And again, the total amount of facilities are 682 facilities in the Commonwealth. Testing continues at these facilities. There's been 443 facilities, so just about half of the facilities in the Commonwealth have had some testing capability done, with 21,394 tests have been completed at this time. Yesterday, the governor provided an update with the non-essential business closures extended to May 18th. Also, he announced a reopening advisory board, which will be headed by Lieutenant Governor Karen Polito and Secretary Keneally, who's the head of Housing and Economic Development. And the makeup of the committee is made up of public health, business community, and municipal government leaders. They're charged with reopening the Commonwealth in phases based on health and safety metrics. And they're looking for input. They'll be soliciting input. They'll be meeting every single day. They started their first meeting yesterday. And DPH will have the final say over the approval of workplace safety standards, customer protocols, and guidelines, including enforcement. So a lot of work is going to be done over the next 3 weeks, and they will be looking for input. But I looked at the list. There's I think it's 17 people on the list, and it's a good variety of people from all over the Commonwealth and all over different industries and government and healthcare. Commissioner Burrell is also going to be on that as well. So a couple other things with regard that the governor is speaking now, and a couple of things have just come in, just a couple of minor things. With regards to unemployment, I know Heather and Mike had mentioned that. When we started this, before we started this pandemic, the unemployment office had 50 employees in it. That was back in February. We are now up to 1,200 employees. They are, with regard to the PUA that Mike was talking about, and Heather was talking about, that just went into effect. There were 80,000 calls in the last week and they've called 80,000 people. They've processed 200,000 claims. So they've really been working as quickly as they can to get all these claims processed. The unemployment rate is going to be well over 20% at this point. And fine, a couple of last minute things. One last thing that's affecting this area. I did reach out to the Senate this morning just to find out how the order from the governor to extending it to May 18th changes the special election for the Senate race being filled by former Senator Vinnie DiMacedo on May 19th. And at this point, there are no plans to change that. So it looks like at this point that Senate race will happen on May 19th. And I know Town Clerk Larry Pizer has been on the show. and has been out in the news media indicating that you can get absentee ballots, but there will be polls open as well. But strongly suggest absentee ballots to actually vote if you plan on participating in that May 19th election. And that's the update for today, Steve.
Thank you. Mathew Muratore, Plymouth State Representative. You can email your questions to plymouthinfo@pactv.org. We strive to provide you with verified information from officials and experts in fields. Looking at tomorrow's lineup, the health component will be with Dr. Philip Triffletti, primary care physician, Beth Israel Deaconess. We'll also be joined by John Rogers. He's the Hub Program Manager for the Plymouth County Outreach, and he'll be accompanied by Victoria Butler. She's the Program Coordinator for Plymouth County Outreach. Steve Cole, Executive Director, Plymouth Regional Economic Development Foundation, and of course Ken Tavares and Matt Muratore join us each day. And we're now going to go to our question and answer portion of our update. First question is for Dr. Barry Potvin, and the viewer asks, we've been told that wearing a mask does not protect the wearer, but rather people they come in contact with in case they have COVID without symptoms. Can a mask be worn several times by the same wearer without washing or throwing away? Dr. Potvin. Barry, you need to unmute yourself. And here we go. Dr. Barry Potvin is the Vice Chair from the Plymouth Board of Health. Barry?
Okay, I'm on now, I think. Yes, you can wear it several times. It's probably better to wash it as often as possible. You have to remember that when you're wearing it, you could be getting virus particles on the inside or outside surface of the mask. They wouldn't live forever on the fabric. So it really depends upon how often you're wearing the masks and for how long you're wearing them. But we'd certainly encourage everybody to wash them as often as you possibly can.
Thank you, Dr. Barry Potvin. Next question we're going to send to Michael Jackman from Congressman Keating's office. Mike, the viewer asks, is there any funding for hazard pay for essential workers who are not necessarily physicians or nurses or long-term care facility staff? As an essential healthcare worker who's not missed one day of work, and I'm not able to do my work from home to do my job, I'm wondering if those of us who are risking ourselves and our families daily will receive any type of hazard pay. Mike.
Yeah, Steve. So I don't think there's been anything included in the 4 rounds so far that Congress has passed for coronavirus relief. I know that there has been some discussion about including it in future rounds. I think people might have seen Senator Warren released an essential workers Bill of Rights that included a premium for essential workers, both healthcare, food service workers, and other frontline workers who are, doing so much for us during this difficult time. And I just noticed that there was some talk in the press about the Congress possibly considering a premium for federal workers who are on the front lines too. So we don't know yet what will be included, but as has been the case over the last 6 weeks, 8 weeks going on, that we've been in this situation. We have been hearing a lot from our constituents about where the needs are, and that's really important that people continue to do that. We want to support our frontline workers as much as we can, and this will definitely be something that the Congress will look at in the next package.
Thank you, Michael Jackman. He is with Congressman Bill Keating's office. In an earlier update, I did report that I'm aware that a local union did negotiate an hourly wage increase for these workers to receive some hazard pay, and that was part of a union negotiation. We're going to go to Heather Cozby. Heather, the viewer writes, I understand some people have received tax refunds. Are they being sent out by the IRS and the state?
The regular tax refund?
Yes.
If that's what they're referring to, yes, those systems are all in place. I encourage everybody to be using electronic filing to move those refunds along. If you have your direct deposit information, it should go right in there. If you prefer to get a check, you'll get a check and it will take a little bit longer. But there's been no stopping of those systems, even though verbal access to the IRS. I don't know about the Department of Revenue, Mass, but the IRS doesn't have a lot of staff. There's no phone calls. Even the tax practitioners who have a separate hotline, not manned. So you can't get a lot of interaction with them, but their systems are processing returns and issuing refunds.
Thank you, Heather Cozby, CPA, Town of Plymouth. Next, going to Amy Naples and Mike Hargrave. And a viewer asks if there's another local entertainment performing group, are they still able to volunteer to participate? Amy
I would
Naples.
say no, because we're in pretty thick with the planning stages, and we are moving very quickly on this event. We certainly hope to have future events, so certainly send me an email, amy@plymouthchamber.com, and we can have you volunteer and participate at another time. But if Mike would agree with me.
Michael Hargrave with Masks for Meds. Michael Hargrave. Masks for
Sorry,
Meds.
I was muted. Yes, I agree with Amy. At this time, we're already, we're creating the T-shirts that will be for sale to help generate funds. We've already come up with the flyer, so things have moved along very quickly, and we're also kind of limited and not limited. It's a 3-hour event, but we want to have each artist be able to perform for at least 15 minutes through this. So I agree with Amy. At this point, we cannot accept, but definitely send us your information, because hopefully we'll be able to put on another event in the future, and would be happy to hear from all artists in this town.
Thank you. Michael Hargrave is with Masks for Meds. We're going to go to Mathew Muratore, Plymouth State Representative. And the question from Matt: would you in the future be able to provide us with any statistics regarding the incidence of COVID-19 in state prisons and houses of corrections? Matt.
Yeah, what I'll do is I'll reach out to Sheriff McDonald. It's not public information. It's not put on the mass.gov website for this, but I'll reach out to Sheriff McDonald, see if he can provide any to us on a periodic basis. But I don't know that, in talking with him this morning, that there are no cases at the Plymouth Correctional Facility at this point.
Thank you, Representative Mathew Muratore. Sheriff McDonald has been on our update. And as you can see with the presentations of local, state, and federal officials, that we are all talking with one another to try to respond to the coronavirus. We're now going to go back to Heather Cozby. Heather, a viewer writes, what if you've not filed both 2018 and 2019 taxes? Will you still get a stimulus payment? The website continues to say not available when the viewer looks at it.
So that will happen as a part of your 20 tax return. So if you were behind and just didn't have returns filed, and you're not considered a non-filer, meaning you should have filed and you just haven't filed, you will be able to have that tax credit refunded as a part of your 20 tax return if you qualify for 20. And so you won't get that money until next year, until spring of 2021, when you file that 20 tax return.
Thank you, Heather Cozby, CPA. And each day we also go back to our panel and ask each of our participants to give us a closing statement. We're going to begin with Dr. Barry Potvin. He is the Vice Chair of the Town of Plymouth Board of Health. Barry, what do you want people to remember today?
Yes, hi, Steve. I was actually anticipating a question about outdoor activities and masks, and it didn't come. So I should just clarify that quickly. Unlike some of the other communities which have mandated masks must be worn when engaged in outside activities like walking and jogging and biking, the Plymouth order does not. But you do need to maintain physical distancing and separation of at least 6 feet out of concern and considerations for others. Beyond that, I would probably say that I hope that most people feel that we are not asking too much by asking you to wear masks under these conditions, especially in relative to what a lot of other people are doing. There's an awful lot of hard work going on the part of an awful lot of people to try to protect and help others in the town. Please also remember that you need to be patient, considerate, cooperative, thoughtful, and calm. If you need some help, obviously, as you might have noticed from these
Come on,
shows,
TV show,
there's a
please leave
lot
a
of
message.
resources available to you. You just need to reach out. Be sure also to try to check in with neighbors, friends, and other relatives that are not living with you to make sure they're okay, see if they need anything, and if they can, try to help them out. Thank you, Steve.
Thank you. That's Dr. Barry Potvin. He is the Vice Chair, Town of Plymouth Board of Health. We're next going to go to Michael Jackman, staff at Congressman Bill Keating's office. Mike, what's the takeaway from today's presentation?
Yeah, again, thank you, Steve. I really appreciate being on, and as much to get my message out as to hear from other people. It's great to hear what's going on in the town, all the great stuff that the chamber's doing and the businesses. I especially appreciate being on the same day as Heather because I learn a lot from Heather. Heather, I always take notes from the things you say because I know our constituents are going to ask us about the same things and you have great information, and I applaud you for that. The only thing I would mention, again, I always try to mention the census because we are in census season, the 2020 decennial census. Just to report, the Massachusetts rate is 55.8%, the response rate. Our district, 9th district, is very low. It's 45%. A lot of that is because of post office boxes that folks have, especially on the Cape and Islands. Plymouth's rate is above the state average, 57.4%. So again, I would urge folks to go, if they can, to respond to the email or the postcard that they got. If they haven't got anything yet, hopefully later this month or actually in May or later in May or June, they will be getting contacted by someone. But they can always call the census and get more information, and I think they can actually file their census over the phone too. So census is so important. A lot of the federal funding that we're talking about is based on the census. So we're always urging people to make sure that they're counted and make sure that they are responding to the census in any way that they can. And again, thank you, Steve, and everyone have a great week.
That is Michael Jackman. He is staff at Congressman Bill Keating's office. We'll go back to Heather Cozby. Heather, what should we remind our viewers today?
First, I just want to say thank you to Michael. I enjoy being on with you too, because I like how you always say to send the questions to your office. It's fantastic. If you have any questions, reach out to me directly too. I'm happy to continue to provide assistance in any way. I think the last thing I want to talk about is something that's going on that's not being talked about a lot, which is this idea that people are realizing they're making more money on unemployment than working. So with all these funds coming out for the PPP funds, employers want to rehire, and employers are going, no, I want to have my unemployment. I really want to just caution everybody a few things. Number one, if you are the person unemployed saying that, you're committing fraud by continuing to tell an employment office that you, in fact, were not offered work when you were. And number two, I'm going to remind the employers, we all love our staff, and this has been incredible, but you don't have to rehire the same people either. So, these are a lot of hard decisions that if you get pushback and things you don't like as an employer, you're going to have to make the right decision for your company. And when unemployment ends, the federal benefit 39 weeks out, be cautious in how you expect people to feel entitled to have those jobs back. And if they weren't willing to come back when you needed them, those are some hard conversations, but do the best thing for yourself. And, thank you to everybody out there and keep doing hard work.
Thank you, Heather Cozby, CPA, Town of Plymouth. Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. What do you want us to remember today?
Of course, as always, thank you for always supporting our local businesses. They need us now more than ever. I also want to give a big shout out to PAC TV, not only for providing these great updates every day, but PAC TV has agreed to be our media partner for Coachella. And this fundraiser could not be possible without them. So I just want to thank them for their hard work, expertise, and willingness to jump right in to make this event a success. And lastly, of course, if you are interested in making a donation, we would be so thankful. The small businesses in our community would be so thankful. And you can do so by visiting plymouthchamber.com to donate to the One Fund. And as always, distance socially and support locally.
Thank you. Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. And of course, we do thank PAC TV and Julie Thompson and all of her staff, both in the studio, in the production room. There's a lot that goes on behind the scenes, not only during the live broadcast, but in preparation before and in planning and review afterwards. This is number 34. We did 3 others. There's been 37 presentations in a little over a month, not to mention the municipal meetings that they cablecast. So again, thank you to PAC TV and to Michael Hargrave, Mass for Meds. Mike, what's your takeaway today?
I also want to share just a huge thank you to PAC TV, because we presented this idea to them, and the immediate feedback, they didn't have to think about it. Their immediate feedback was, how can we help you guys out? This is a great idea. And for them to hit the ground running with it immediately with their technical expertise was just phenomenal. And it's helping make this event what it is. Also want to thank the Chamber for their involvement with our organization. Without them, none of this would be possible. They were fantastic. And also just to remind people to visit massformeds.org or check out our Facebook page for updates that are going to be coming out over the coming days leading up to the event. And also it gives a great backstory as to what we've done already and what we're hoping to accomplish. So if viewers can check that out, that would be great. It'll answer probably all of their questions. And Steve, thank you again for inviting me on here.
Thank you, Michael Hargraves, Mass for Meds. We're going to go to Matt Muratore, our Plymouth State Representative, for your closing statement. Matt?
Yeah, thanks, Steve. First of all, I know some people are disappointed that the order has been extended by the governor, but the good news of that, it's extended a little bit longer. It could have been extended longer than that, but he's realistic about this and what he's trying to do, and by putting this advisory committee together. So be patient. We will get there. Stay informed. As I say every day, stay informed by going to mass.gov/COVID-19 or ask questions by calling 211. Get text alerts from to COVID MA to 888-777, or in Spanish, COVID MA ESP to 888-777, or for health questions, Bowie Health /mass. So continue to stay informed, stay calm, stay home. I know the weather's starting to get better. Go out in your yard or take a walk and socially distance, and wear your mask, as the Board of Health is saying. We've gotten this far as a Commonwealth because of everything you are all doing by staying home. As I say, you're all heroes if you're staying home. We have a lot of heroes in what's going on. And there's a lot of silver linings in what's happened over the last 37 days or however long it's been. And PAC TV is one of them. I think I'm a proud member. I've disclosed this before as a board of directors of PAC TV. I've been a proud member of that board for a couple of years, and I see how they operate. I see how they are committed to the community. And I think the silver lining is that more and more people in this area, in Plymouth and in Kingston and Duxbury and Pembroke, are really seeing the value of PAC TV and what they bring to a community, and how they bring a community together, and what they're doing for Conchella, and actually bringing folks together and raising money. There's so much that we are thankful for in this community to have a public access station like PAC TV. Again, to Julie and to the entire team, you folks are just magnificent what you're doing, and I hope people are recognizing the fact and appreciating the fact of what you are doing for all of us. And we also need to thank all those essential employees who are taking care of our physical health, and those taking care of our economic health. They're all true heroes in my mind. And again, as I say every day, the more we come together by staying apart, the faster we'll get back to the people we love and the things that we love to do. So stay safe and be well, and thanks again, Steve.
Thanks, Representative Mathew Muratore. And thanks to all of our guests. They include Dr. Barry Potvin, Michael Jackman, Heather Cozby, Amy Naples, and Michael Hargrave. And at this time, we're going to go back to the chair of the Plymouth Board of Selectmen for a closing statement from Ken Tavares. Ken.
Steve, thank you. My closing statement today is stay the course. You are making a difference. Be the example. Thank you.
Thank you, Kenneth Tavares. He is the chair of the Plymouth Board of Selectmen. Tomorrow we welcome Dr. Philip Triffletti, attending physician at Beth Israel Deaconess. Also, John Rogers, the Hub Program Manager of the Plymouth County Outreach. He'll be accompanied by Victoria Butler, who's the Program Coordinator for Plymouth County Outreach, Stephen Cole, the Executive Director, Plymouth Regional Economic Development Foundation, and of course, Kenneth Tavares, Matt Muratore, and I will be here. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us. Good day.